Good afternoon, everyone. This is Melissa Morin. I'm a Public Information Officer with the Whatcom County Health Department and Whatcom Unified Command. I want to thank you all for being here today, and also thank you for adapting with us as we use this new technology to help us all stay safely distanced and separated from one another. We're working on just getting a couple more things set up here. As you can see, we're getting all of our presenters for the day set up so that you can see them as they'll be talking with you. And just a couple of other things before we get started. We ask that you go ahead and keep yourself muted during the conference. We will have a Q&A period at the end of the speaker's time. At that time, we'll go ahead and enable the chat feature. And if you'd like to ask a question at that time, you'll be able to let us know in the chat function, and I'll go ahead and call on folks at that time to ask their questions. If you haven't already done so, please go ahead in the attendee module and identify yourself by editing your name and adding your affiliation. That'll help us identify folks later to call on you for questions. And I believe that once we have all of our speakers on here, we'll be able to go ahead and get started. So just hold with us for a couple more moments. Okay, we're going to go ahead and get started. I'd like to introduce our first speaker, Erica Lautenbach, the Whatcom County Health Department Director.
Good afternoon. The Whatcom County Health Department's role in our community is to lead in preventing disease and improving the health of all residents. To that end, it is a core function of public health to lead community-wide planning and response efforts with science-based decision-making. This includes addressing emergency public health issues and threats like COVID-19 pandemic. One of the ways we do this is through collecting, synthesizing, and analyzing data about disease outbreaks, and then developing forecasting tools that guide our assessment and planning. We are fortunate to have the additional expertise from our Western Washington University partners in this work. Today, we want to share some details about our forecasting model. Since even before the first local case, the health department and our Western Washington partners have been working to develop tools to guide planning and decision-making, and have been refining it as new information comes in. We now have more data that tells us more and better reflects our local conditions more comprehensively. We'll go through some of the details, but here's an overview of what the forecasting model is currently showing us. First, we see signs that we could be on the downside of a wave of the COVID-19 outbreak. This could be attributed in part to social distancing measures taken in Washington state. Second, the model shows us that if we lift all restrictions and go back to life as normal, we could see a large second wave of infections, hospitalizations, and deaths. The model doesn't forecast or predict what will happen, but it does show several possibilities of what could happen after May 4th, when the current stay home, stay healthy orders could be lifted in Washington state. I'll now turn it over to Amy Hockenberry, Health Information and Assessment Supervisor for the Whatcom County Health Department.
Thank you, Erica. So I want to start by explaining why this model is different from others you may have seen before. Several models of the spread of COVID-19 have been shared publicly. It's important to understand that the assumptions and parameters of these models are based on what we know about the outbreak and what has unfolded so far. For Washington State, the numbers in these models are based largely on King County. For local planning, it's important to develop simulations for Whatcom County specifically, and my colleagues will speak to how the model was designed to reflect local conditions in just a bit. It's also important to remember that the forecasted numbers in the scenarios will change over time as we add new real-time data. The output numbers of the simulation, for example, the future of number of infected people or number of hospitalizations, will change as we input the current number of confirmed cases or adjust other parameters of the model. Just as important it is to remember is the fact that the output in our simulation will also change based on human behavior. For example, how many of us stay home to keep the spreading of the virus? This is the part of flattening the curve that we all have a part in controlling, because every individual action is part of the picture. Similar to other models, our model indicates that the number of people infected with COVID-19 in Whatcom County has likely reached a first peak. Our model currently shows that it's unlikely that we will see a further peak of infections between now and early May. This matches data statewide and indicates social distancing measures have worked to flatten the curve and prevent more people from becoming infected. This is good news. It means that our community efforts have helped. It also means that we aren't completely through this yet. We need to continue to stay home, stay apart from others in public, and be vigilant about washing hands if we're going to see the downward trend continue. Our model simulates scenarios after May 4th that demonstrate a range of possibilities if we relax our efforts to keep the disease from spreading in our community. Any change in current policies and personal behaviors will likely increase the rate at which infections in our community will grow. As you can see in this figure, without further measures to control the spread of the virus, we could see a second wave in infections that would peak later in the summer. What we also see in this chart is the cumulative number of people infected with COVID-19 for high, medium, low, and lowest scenarios. The model predicts that continued social distancing, the blue line, would mean that for every 10 infected people, only 8 others are infected. In the high scenario, every 10 infected people, 20 more would be infected. And as you can see, the number of total cases would jump back up dramatically. This is even if we maintain all mitigation measures for another 3 weeks up to May 4th. When another peak could occur and how large it would be depends on what kinds of social distancing actions we have in place, how we're able to test and contain the spread of the virus through contact investigations and quarantine, and the choices people make about their own behavior. The scenarios in this chart represent the possible outcomes associated with those variables, and each of the scenarios in this chart are possibilities that we must plan for. So we'll turn it over to Jack Herring. He's one of our co-authors of our report and will be able to share more about background of the model.
Jack, do we have you with us? I think that Jack may not be joining us quite at this moment, so maybe we can move on to Steve Bennett.
Sure, thank you. I just wanted to speak to a couple points. I think one that has already been clearly stated by Amy. about the impact and application for public health within the county when trying to interpret some of the data that's shown in this model, as well as its public health implications, which is that if or when social distancing measures are relaxed, at best, we will see a slow in any perception that has been discussed about this downward trend in cases. And depending upon the level of that relaxation, we may actually see a possible plateau of cases, and then with more relaxation, a rise in case numbers depending upon changes in policy and public behavior. And that our data really indicates that this is not a pathogen that's just going to go away once we pass our epidemic peak, and that the data is indicating that this is going to be a longer process. And what's really important to understand as far as the epidemic curves that we are showing is that if we have any instances of large community meetings or family gatherings that can turn into spots of spread, they're going to dramatically impact transmission and infection rates within Whatcom County. Which brings me to a really important point and second point about the model, that it's important to understand that clusters, such as outbreaks associated with long-term care facilities or other types of congregated living situations, are not simulated within this model. In areas with smaller populations and lower population density, such as Whatcom County, when we compare this to, say, King County, clusters impact our comparability of the model to what we experience in real life in a much more dramatic fashion. For instance, if we had an extra few cases in King County, that might not necessarily show up as an outlier within their larger data because they have a larger population. However, if we suddenly have a pop of 10 cases in Whatcom County, it's much more impactful in how our data looks. And so it's continuing, and even once we passed our peak, it's going to continue to be really important to understand cluster transmission in the county, and as well as transmission among some of our more vulnerable groups. And currently the Whatcom County Health Department is actively working to prevent and reduce clusters, especially in long-term care facilities. And then were we able to get Jack back into the meeting?
Can you hear me, Steve?
I can hear you lightly. So I'm going to hand it back over to Jack, and he's going to talk about the process of building the model.
I apologize for that. For some reason, GoToMeeting wouldn't connect me to the audio. So I don't know if people can hear me clearly or not because I'm on the phone right now, but I'll try to speak up. So as Amy and Steve have already talked about a little bit, I'll give a few more details about the model itself. So this is an updated COVID-19 model for Whatcom County that gives us a new set of tools for simulating the pandemic. And this model has gone through a validation process by the Whatcom Unified Command Surveillance Team, of which I am a part.
This is Melissa Morin again. It looks as though we may have lost Jack's audio. We'll work on getting him back connected. But for now, I'll turn it back over to Erica Lattenbach to say a bit more about how this model will be used.
Thanks, Melissa. At the Health Department, we'll continually use this information to guide our planning together with Whatcom Unified Command. As we've all said, the exact numbers in our planning scenarios will change over time, and frankly, they should change over time because we enter real-time data into the model, so it's the most accurate tool possible to inform our planning. We will continue to provide updated simulations to the community as new data are made available. The information this model and the simulations provide us is vital to our planning and mitigation efforts to prevent the spread of COVID-19 outbreak. First, it assists our Unified Command in surge planning, which means it helps us in planning how to ramp up facilities, equipment, and personnel needed. And it determines how big or small that second wave could be so we can plan appropriately for the range of needs that might occur. Secondly, it also helps us plan for the kinds of strategies that we need to put in place to keep the rate of spread low even after the current social distancing restrictions are lifted. As we said earlier, the model shows different scenarios for the further spread of the virus when restrictions are lifted. And this informs us as we consider what the right actions are to take to limit further spread. It shows us that returning to life as normal will have to be done gradually. And the way I like to think about it is that it's more of a dial that we're turning rather than a switch. This will have to be gradual. We will turn the dial in different ways. And if we see additional spikes, we may turn it back. Or if things continue to improve in certain ways, we may dial it a bit more. But this is going to be constantly calibrated and titrated so we can get this right to prevent the spread of disease. It's not going to be a situation where, like we said, life goes back to normal and all of the things that we enjoyed doing in the past we can once again do, because that will put us all at risk. So I guess with that, I think it's important to just remind folks that now's the time to keep up with the good actions that our community is taking. What we see is promising, and that's great, but we aren't out of the woods yet. And each action the community takes to protect others helps prevent what we're seeing in these simulation exercises that could put us back in a very challenging situation in terms of infection and hospitalizations and death. And I recognize that it's spring, it's a beautiful day outside and the sun is shining. And I know how difficult it is to stay home and stick with it. We will all want to be able to go and live our lives, but it would erase the progress we've made in controlling the spread of this disease. So in closing, we're in this together and we'll emerge from this. And when we do, we'll be stronger, but we can't emerge just yet.
Thank you
And
for
this
that,
is Jack.
Eric.
Somehow I'm back on, I believe, although I don't know for sure.
You are, Jack. Please go ahead. Thank you so much.
Okay. Well, I don't know how much of what I said before came through, so I'll just start from the top. So as people before me have already mentioned, we've got an updated COVID-19 model for Whatcom County that gives us a new set of tools for simulating the pandemic. And the model has gone through a validation process by members of the Whatcom Unified Command Surveillance Team. And so among the changes, we've adjusted the input data for the model to better represent the emerging regional, state, and international observations of COVID-19. And most importantly, this second version of the model allows for the simulation of more complex scenarios, including how the transmission of COVID-19 will change in response to observed and anticipated social distancing measures as the pandemic continues. Because the virus can spread exponentially, a small increase in the infection rate can have a large impact on the total number of people who are infected ultimately with this virus. An important part of the validation work was to simulate COVID-19 statewide and compare these simulations with statewide data. Some of our preliminary data suggests that social distancing in Whatcom County is happening much as it is in King County. So we hope that we can use those larger areas populations to help validate our local model. From this work, we developed a set of simulations for COVID-19 in Whatcom County. The values selected in the chart, for example, that Amy showed you earlier, for the infection rate over the time period are consistent with the literature we reviewed and are shaped by the validation of the statewide model. This model was used to simulate different scenarios for possible changes in social distancing after May 4th, the currently announced date for the governor's, the extension of the governor's order. What basic reproductive number or transmission rate we will actually see after May 4th will depend on government policy and individual behavior. And we will continue to refine this model as current public health interventions are modified. So I guess I will turn it back to Erica at this point.
This is Melissa. I think actually we'll go ahead and open things up for questions. Folks should be able to use the chat feature now. So members of the media, if you have a question you would like to ask, go ahead and chat your name into the chat feature, and I'll call on folks so that we don't end up with folks talking over one another to ask questions. I'll let you know when it's your chance to ask your question. Do we have any questions? I am not seeing any in the chat at this moment. I see a question from YD. If you want to go ahead and unmute yourself and identify your name and affiliation, you may ask your question.
Hi, my name is Yolanda, and I was wondering if construction workers were still supposed to be building homes. I guess I read somewhere that they weren't, only because I kind of see them close to each other, of course, building and handing back and forth tools and things of that nature. So is that something that is supposed to be going on right now?
Yolanda, this is Erica. I didn't catch your affiliation. Happy to answer your question.
I'm sorry. I live in Whatcom County. I'm not sure. I'm just a resident here. Is this just for the press? Am I not supposed to be on here?
Oh, you're welcome. You're welcome to listen in. And we didn't make that clear. I'm happy to answer that question, but this is a media call, and we ask that only media ask questions at this point. And you're welcome to, if you're on the call, to follow up with us on your own questions. But because we didn't make that clear, I will of course answer your question. So that is a statewide issue that and the governor's decision. The Whatcom County government is following the governor's guidance, and at this point, that's where we are. And until that lifts, we are not in a position to override the governor.
That have asked any questions yet?
So I'm just going to go ahead and remind folks that if you are not asking a question at this time, to go ahead and mute yourselves. And next up, we have Joe Tehan with KGMI. Joe, you can go ahead and ask your question.
Thanks, Melissa. I'm wondering about the modeling. We're hearing about the model being made, but we're not, unless I missed it, any specific numbers, or is it giving us a crest date as far as when we might see the most, we might see the top of the hill, and when we might see a reduction in numbers, or an idea of how long we here locally might be best to sequester ourselves? Is it giving us specifics, I guess, is what I'm asking.
Well, this is Jack Herring. I'd be able to say a couple things. First of all, we're not forecasting the future here. Really, what we're showing is how the fundamental trends of this pandemic may be working in Whatcom County. So anything that we show you, if you treated it as a forecast, that would not be the best use of this information. But we do think that it is quite robust, that we have probably passed a peak in the number of infections, Now, the number of infections, remember, that happens first. People get infected, and then maybe they get severely ill, and then maybe they go to the hospital or not, and then some of them might pass away, unfortunately. So when those other events that might be very visible and painful would peak is a different question. But we believe that we've probably passed the peak in the number of infections for this potential first wave. And whether we even have a second wave or not depends on decisions that have not yet, to my knowledge, been made. So giving you a forecast of when the ultimate peak in the epidemic is beyond the scope of what we're trying to model here.
May I add to that? When we talk about forecasting, I think sometimes that calls to mind a weather forecast. And there's a lot of data and a lot of years of trends to know that maybe tomorrow it's going to be between 56 and 58 degrees. And of course, for everyone's certainty, it would be ideal if we could provide that level of consistency in predicting the future. And I think the best analogy is because this is a novel coronavirus, we have actually had to build the entire meteorology tool, and we are now testing it for the first time. So while you may see a weather report that shows within a couple of degrees, we are at a point where, let's say, we could predict it's going to be between 30 degrees and 80 degrees. And how you prepare, what you wear, what activities you engage in are completely different based on that. And it's also based on lots of things out of control of the forecasting, like policy and individual decision making. So while everyone would love to have the level of certainty that a weather report predicts, this prediction tool is much more open. It will become better and better as we build more information. But I think it's an important analogy that there's many, many years of weather predictions available to us and trend lines. And this is our first go with the coronavirus because it is so new and so novel.
Our next question is from Robert Mittendorf. Robert, go ahead and ask your question.
Hi, this is Robert Mittendorf with the Bellingham Herald. Thank you for taking the time to talk to us today. We appreciate it. I'm wondering if you will publish the actual models so we can all see the figures that were used and where the data came from. And will you start publishing new models as they become available? And also give us, the sources. I'm guessing because Jack did some of the research, he was using Google modeling and some of the other online calculators, but I think it's good for the public to know where these numbers are coming from. And also, well, okay, that's enough for right now. Thanks.
This is Amy Hockenberry. I would say that we're working with Unified Command to be able to use this information for planning purposes. As far as the publishing of the report, I can't speak to that at this very moment. Erica might be able to do that. I might direct that question to you, Erica. But as far as future, we are going to continue, as mentioned earlier by I think all four of us, is that the modeling will continue to evolve as more research and data come available. So we'll be looking to, in a more systematic way over the coming weeks, to at least weekly be able to inform unified planning with the models that the surveillance team is working on.
I want to clarify too, because I heard you say, Robert, whether or not we have a new model. And I just want to clarify that this is not a new model. We have been adjusting our forecasting tools over the course of this exercise. So this isn't a situation where we're picking new models and new forecasting tools as we go. We are calibrating and gathering more information and inputting more into the simulation tool. It's still using a lot of the same assumptions, but we are but we're creating more data in order to make it more comprehensive and more predictive as we go.
Our next question is from Brent Lindquist with the Linden Tribune. Brent, go ahead and ask your question.
Hi, everyone. Thank you for taking my question. I am just wondering, Steve had mentioned that this model does not necessarily account for these clusters at long-term care facilities, and that there are some extra care and methods being taken to sort of prevent further clusters at these facilities. Can you guys describe those methods at all, those sort of extended methods to prevent cases from sort of exploding at those facilities again?
Sure, I can give you some more information about that. Our communicable disease team at the health department are taking a number of different actions regarding these clusters. The first is we have a rapid testing response team. And once there is notice from a facility that they have a case or a presumed cluster of cases, we have our team of nurses that go out and test all of the residents that may or may not be impacted. And we, for example, in one given day had tested 200 people. So this team is really ramped up and is able to address some of these issues quickly, because the sooner we know who is positive and who may be positive, the more quickly we can contain, and we can make sure that implementation of further precautionary measures on the part of staff and the residents is implemented. So that is one of the steps. The second step, which we talk about quite a bit, and you may be familiar with this, but we do case and contact investigations. So once we have a positive case, we do extensive looks into who they may have exposed, who they've been around, make contact with those individuals so they can be in a position where they can be tested as well at our drive-through testing clinic at the health department. So once we know about cases, whether they're in clusters or not in clusters, we're able to very quickly address the potential exposures. The third thing that we're doing with the long-term care and skilled nursing facilities and assisted living facilities is we have staff who are on a daily basis calling these facilities to provide support, to provide guidelines, to provide them with options, and frankly ask the questions like, how much PPE do you have? How much do you use in a day? How long will this last you? Will it last you 48 hours? Do you need more? So providing that kind of support and service, and these are nurses that are talking and providing guidance and can go in and provide more technical assistance to them as well. The health department locally does not license or monitor these facilities. That is done at a state level, but we are providing local support to make sure that they have the tools they need to address these cases quickly.
We have another question from Robert Mittendorf. Robert, go ahead and ask your question.
Hi, thanks. I just wondered where the recording of this press conference would be available. You going to send a link, or will it be at the COVID-19 website on the county page?
This is Melissa Moore, and again, we will be making it available on the Whatcom County Government YouTube channel. It'll also be available on the Whatcom County Health Department's Facebook page, and we will have links to it from both the Whatcom County Health Department's COVID page and also from whatcomcovid.com.
Thanks, Melissa.
Our next question is from Ron Judd with the Seattle Times. Ron, go ahead and ask your question.
Hi, folks. Thanks for taking the time. You just talked about the measures at the nursing facilities, and I have two questions about that. The first one is, when was the county health department able to ramp up testing to the level that it's at now, like going into a home and testing everyone there? When did that start? And the second question is if you could talk a little bit about policies about staffing at nursing homes and nursing facilities and senior facilities, and how those have evolved throughout this month-long wave of infections. Thanks.
Sure, thanks for your question. First, we have had our drive-through testing facility available since, I believe, February 21st. And I want to be clear that our testing, the public health testing, is in service of public health surveillance and controlling clusters of exposures. So we are very targeted in the way that we test. The clinical community is responsible for individual and clinical testing. We do the public health testing. So the testing that we're doing is matched to address the surveillance issues and the cluster issues. And we have repurposed nearly all of our nursing staffing in order to accommodate this, and have enlisted some previous Whatcom County Health Department nurses to help in a volunteer capacity as well. So we are at this point equipped to be able to do this work, and have gotten a lot of support from the facilities in facilitating that process. Your second question, I believe, had to do with the policies and practices at these facilities.
Actually, I was curious about staffing at the facilities. I know that there was, it seemed like there was a change made in recommendations to facilities about people who work at multiple healthcare facilities sometime after the Shuxon outbreak. And I wondered if that changed specifically because of that, or if there was any change in practice there as this went along.
Mm-hmm. Well, this is as I'm sure you can appreciate, a complicated issue, because the nature of this profession in healthcare is underpaid for an individual to be able to only have one job, essentially. And so there were a number of employees that worked at different facilities, and that was made clear to us. And there's also, in-home caregivers that provide those services to a number of different people. We've really tried to address the issues of staffing by ensuring that the necessary PPE are available to staff that are asymptomatic, and we recognize the challenges of understaffing at this point at these facilities, and trying to give them support and resources to address the shortages in staffing and the challenges that presents. The last thing we want is for a facility to be unable to care for its residents and have all of those residents go to the hospital because there is not an adequate place for them to go. We are trying very, very hard to support these facilities so they do not send their residents to the hospital and fill up beds that need to be available in case there is a medical surge.
Our next question is from Oliver Lazenby with the Northern Light. Oliver's question is, what role might the county have in mandating social distancing going forward? For example, would the county issue a stay-at-home order without the state?
I think this is a much better question for the elected officials in our county than for me to answer.
We have another question from Joe Tehan with KGMI. Joe, go ahead and ask your question.
Thanks, Melissa. This is primarily directed at Erica, I believe, and it's outside the realm of the modeling per se, but my question is about those who've been confirmed with the coronavirus. I've spoken with Peace Health St. Joseph Medical Center, and they say they've had a relatively few patients that they've cared for there. And we've got well over 200 now confirmed cases in the county. My question is, where have these people been cared for, or have they been just isolating at home and working through the symptoms of the illness? Do you have any more information on that? Why there have been relatively few actual hospitalizations?
Sure. We know that there's quite a range of symptoms associated with COVID-19, from no symptoms at any point in time to severe symptoms that lead to death. So there is a range, and we don't know the experiences of all the people that have been tested positive, but we are having conversations with individuals immediately after they've, in our case investigation work, after they've been tested. And I think the range of symptoms follows the range of how people are handling the disease if they're a positive test. So some may be able to stay home for a few days and recover and return to work after it's safe to do so. Some may need additional supports from family or friends or others that are able to safely do that. Some are already in these facilities where they're receiving nursing and other care. And that's what we've seen in many of these cases among these clusters in skilled nursing and long-term care facilities. And then some who have the most severe illness are going to the hospital. I think the word has gotten out that unless you have really severe symptoms, that the hospital is not the best place to be, that most people who do not need ventilators or intensive nursing care can recover safely at home. So there's a range of symptoms, and there's a range of responses that people have when they receive a positive test.
If I could just follow up really quick, does that bode well then for our being prepared for a potential wave and where we are situated as far as our hospital facility?
Would one of our statisticians, epidemiologists, like to answer that?
Personally, I think it does at this point. However, I think that's assuming that we stay on the current trajectory that we're on. If we have changes in policy or changes in public behavior, as we know public behavior can change without policy changing, then we could see that kind of secondary wave or that increase start to happen. Or even just a consistent transmission that looks like a plateau, which could then stress our hospitals 1, 2, 3 weeks down the line as the number of sick people continue to rack up. I think that we often get really focused on the peak and when that first peak is done. But I think sometimes for public health, the most important story is what happens post-peak to ensure that that's our only peak.
Okay, I believe that's the end of our questions. So we will go ahead and end the conference. Thank you all for being here. And again, just as a reminder, a recording of this will be available on the Whatcom County Health Department's Facebook page, the Whatcom County Government YouTube channel, on the Whatcom County Health Department's COVID page, and also at whatcomcovid.com. Thank you all again for attending.